News this afternoon, a big congratulations to Dr. Kenneth Mattox, the chief of staff at Ben Taub, who announced he's going to be retiring.
Yeah, health reporter Haley Hernandez is joining us now. And Haley, Dr. Mattox has quite the long history of serving Houston area patients, right?
That's right. Dr. Mattox actually started at Baylor as a medical student in 1960. He actually never even interviewed anywhere else because he felt that Baylor lined up with his religious upbringing. And back then, guys, emergency medicine really didn't exist. But among fellow students, Dr. Mattox wrote out on the back of a napkin their vision of a trauma hospital, which ultimately became what Ben Taub is today.
If you count his time as a student, Dr. Kenneth Mattox has been working at Ben Taub for 60 years. I first met him in this 2018 interview where he told me about training military surgeons before the Persian Gulf War, a legacy that lives on between Ben Taub and our front lines today.
What they would do, they would take their cell phone, put it into the wound and say, what do I do with this kind of chest injury?
But that's not even cracking the surface of his accomplishments at the helm of Ben Taub. In this footage from the 1990s, he's telling colleagues the importance of equality in healthcare, a passion he still stands by.
They deserve equal, if not better results than the people who pay a lot of money for private hospitalization.
Under his guidance, the hospital has done that, and all while discovering new operations, creating new treatments, and gained the community's trust as a go-to emergency room.
In the last 5 years, we've been the top 3 in the TQIP scores of trauma, of all the trauma centers in the United States.
But he says the work is never done.
We will get through this COVID. We will find a better way to finance healthcare. And I'm so proud to live in Houston, where together we work. Harvey may come through, but the industries of town, the television stations of town, we all come together. We care for our people. And that's a wonderful place to live.
And so I asked Dr. Mattox what he plans to do in retirement, and it's kind of far from retiring, guys. He still plans to teach at Baylor, put on conferences, and write books, so he will be around. He's just stepping away from his administrative and clinical roles. Guys, back to you.